let's talk about that negative pressure. So you're breathing, you have the negative pressure in the back of the airway, and that pressure gets disseminated into the whole chest. All right. So normally right now, when you're sitting here breathing, you're probably pulling to about -2, maybe at the most -8 centimeters of water pressure, depending on how large of an individual you are. All right. And that negative pressure is what causes air to go from outside of your body in, down your throat, and back into your bronchial tubes and into your lungs. All right. And that's from a vacuum, a negative pressure, as your diaphragm goes down and your intercostal muscles expand your chest. And when you're asleep, that will increase to some small degree on everybody, but it's usually so small that it's negligible. But as you start getting more obstruction up here, that negative pressure is going to increase. And it can get to the point where you may be developing up to maybe -50 centimeters of water pressure or more in your chest. So we now know that the heart is going to function abnormally when there's this increased vacuum or negative pressure that's occurring in the chest. Now let's throw the PES into it, because we just talked about pleural pressure. We just talked about changes on cardiac function and cardiac output and all that occurring with the pleural pressures of sleep apnea. So now in your typical patient, we measure that frequently, okay? And we do that with the PES. So you can see this patient has had an arousal. They woke up, they had some nice big breaths, and then they go right back to sleep. And then as they fall asleep, there actually is no stimulus to breathe at first, okay? And then they do get a stimulus to breathe, and they pull a little bit. They're not getting the air they need. They pull a little bit harder, a little bit harder, a little bit harder, a little bit, and they're starting to snore more as they're getting a little bit of air moving through, and they're getting this increased amount of effort till finally they're working so hard, the brain says, wake up. And then as they wake up, boom, the airway opens up, and now they don't have to work so hard. All right. Look, there's less movement here than there is here. There's more expansion here when there's less effort. This is part of the arousal, right? So you can't measure the amount of effort based on the amount of expansion on the chest felts. All right. So the only real true measure of effort is measuring the pressure.
You might be wondering how our body responds when we sleep. So I can tell you now the most crucial change is our intrathoracic pressure. Dr. Simon talking about the negative pressure inside our chest, and he used the Bernoulli effect to explain that. So that's mean, increase in speed can simultaneously lower the pressure. So that's mean will increase your negative pressure here. So I will use another sample to, demonstrate this principle. So you see, this is your airway. When we are awake, we're able to keep our airway open. So when we're breathing, there's no change in the size of your airway. You see, not much change. But when we sleep, because we are relaxing, we lose the muscle tone. So the airway will become more restricted. So when same amount of the flow into the smaller space will actually increase the negative pressure. And the dose pressure will collapse your airway more. So let's see, this is the one. You see that the space becomes narrower now. So how we measure this pressure change? A thin catheter is placed into the nose while swallowing the water through a straw. And the signal that we refer to as a PES, and to demonstrate the patient, work harder to breathing, and this will generating more negative pressure and triggering the arousal. So hopefully, this video can help you to understand more how the intrathoracic pressure change during the sleep. Thank you.